parents, no, you don't have to have a bigger or a smaller breast.
So regardless of how your breast looks,
if you're a woman, regardless of how the breast looks like, you can get breast cancer. I mean, look at men. You see their chests. Their chests are flat, isn't it? But yet we get men with flat chests, flat breasts with breast cancer.
Oh, okay.
Are you getting it?
Yeah.
Yes. So for us, don't let us focus on women with larger boobs will get breast cancer. No. If you have it small, if you have it big, if you have it medium, once you are a woman,
yes,
then your risk of getting breast cancer is there.
So doctor is saying once you are a woman, definitely there's that possibility of getting breast cancer. So make sure you check your breast every month, and at the end of the year, you go to the clinic for them to check for you. So let's come to the factors. Some say if you have breast cancer in your family, there's a high possibility you are going to get breast cancer. If you go with this particular lifestyle, there's a high risk of you getting breast cancer. So let's talk about the risk factors in breast cancer.
So I will first say that, in fact, the main cause is unknown. We cannot pinpoint that. For instance, we know that malaria is caused by the bite of a mosquito. Okay. So we know that is it. But when it comes to most of the cancers, including breast cancer, the main cause is unknown. Now, there are some few cancers which we know the cause. For instance, the cervical cancer, it's now been linked to human papilloma virus. Okay. So now that's why you could hear that we say do HPV screening and do vaccination.
When you said I didn't understand, but I said, okay, the human papilloma.
So the human papilloma virus it's a virus. So yes, kind of, we know that bacteria and viruses, so microorganisms. So it's a kind of virus that is a sexually transmitted virus, that causes cervical cancer. But for breast cancer, we don't know. But there are some risk factors that predisposes us to the disease. So the first risk factor is being a woman.
Oh, just the fact that you're a woman?
Yeah.
Oh, okay.
Because I'm a woman, there are a lot of changes, there are a lot of hormonal activities that goes on in me that put me at risk. Because of that, I have the breast. So if I don't have a breast, I won't get the disease. Like prostate cancer in men. Women do not have prostate, so we won't get prostate cancer, So the fact that I am a woman and I have the breast tissue and I have hormones that cause the breast tissues to grow, then my risk is higher. Then if you have a family history of breast cancer, in fact, if it's a first degree family history, your risk is higher. Let me explain what is first degree. So the first degree is, let's say, the people within your nuclear family. Assuming your mother gets breast cancer, your father gets breast cancer, or your sibling, any of your siblings get breast cancer, that is a first degree relative. So your risk is higher, and that is higher than the extended family. The extended families are aunties, our cousins, and that. Yet, because they are within our genetic makeups and we have that history then it means that possibly the abnormal genes that leads to the development of the disease is within the family. So that is what it causes. I mean, we talk about family predisposition. So we always advocate that once, previously, mothers and women were hiding the disease. Yes, when they get the disease, they don't even want their daughters to know. But knowing that I've had the disease and I have a daughter, I do have a responsibility to protect my daughter. So I need to be very open and talk about it so that my daughter will know the essence of self-breast examination and will know the essence of going for screening, will know the essence for seeking early interventions or early help when I see something abnormal with my breast. Yes, so that is family predisposition. And then if you do not give birth by age 30, Girls are brave.
Hey, yeah, bro.
Yeah, so normally late parity. So it is advocated that we all give birth by age 30. So if your first child is given by age after the age of 30 years, it increases your risk of getting the disease. And let me explain in simplicity why. In simplicity why, because immediately we start to menstruate as women.
Yeah.
Every month you menstruate, isn't it?
Yes.
And during menstruation, you can feel the changes you get in your breast. And those are coming from the eggs that you are laying, isn't it?
Yeah.
Yes. So once I'm laying that eggs, those are the hormones, the estrogens that are released into the system to act on my breast.
Yeah.
So assuming I get my menses at the age of 10 years, and now young girls, 8, 9, 10, they are getting their menses. And so the age of 10 up to 30 is 20 years. And in each year, I menstruate 12 months.
Yes.
That is if I have a regular menstrual cycle. So it means that for 12 good months, my breast is exposed to those estrogens.
Yes.
So if I don't get pregnant, you multiply 12 times by 20. How many times I'm exposing my breast to the estrogen?
Yes.
I get in it. But immediately you get pregnant, you do not lay eggs again. So those hormones, estrogen hormones, are not released.
Okay.
So once we get pregnant before age 30, it breaks that cycle.
So is it like a pause or it breaks it entirely?
It pauses it.
Okay.
Let me put it.
Okay.
And once you get pregnant for 9 months, no menstruation for 9 months, if you are able to practice breastfeeding well, exclusive breastfeeding well, it is also a kind of a family planning method, But once you are breastfeeding, the hormones that helps with the production of milk also delay you from laying eggs. That is why when they give birth, it takes some months before they start to menstruate again. And all those periods, your breast is free from the exposure to estrogen.
Hey.
Do you get it?
Yeah, I understand.
Therefore, it is advocated that you will give birth early by age 30. Other than if you go beyond that, then it means I have exposed my breast to that estrogen for a very long time. That is why they say early menarche, but late menopause is risk. Because assuming you get early menarche is your first menstruation in your life. That is menarche. So assuming you get your menstruation by age 10, by age 9, and you still menstruate 50, 55, 60, you are still menstruating. Look at the number of years that every month the hormones that is coming from your laying of eggs is acting on your breast. Do you get it? So it's the birthing that causes these physiological changes. Do you get it? So I'm believing that I have made it simple for viewers to understand, so I don't use my medical jargon.
We understand, but we are scared because now women empowerment, people want to get to a particular place before they get married, before they give birth. So,
I don't agree with you. So for instance, as I sit here, if you look at my age, I'll be 44 this year. But
wow,
I started education from for tertiary from diploma level.
Yes.
I went to do degree. I did my master's. And I did a PhD. And I'm still continuing with my career. And in fact, I married and gave birth after my undergraduate program, degree. Before going to do my master's and doing a PhD and working.
And what year was it?
I married at the age of 28.
Okay.
So by the age of 29, I had given birth to my first child, and I was working, caring for a child, continue with my education. So it depends on the support and your support system and the resources that we use. Because commonly now, those times when we were young, you see your uncles, your aunties, your grandmothers all coming to help. But our culture and our new generation and AI generation, I call your group AI generation. It's like our lifestyle have changed. We think that we need to be concentrating on only our nuclear family. We don't welcome our extended family. We don't get the support. For me, it was the extended family. My husband is there pushing me. So get the right man.
Okay.
You get it? My husband is there pushing me. My in-laws were there. In fact, my mother-in-law was practically in there. I give birth from 5 months going, she's there. And I'm able to continue. So once we are able to look out for the resources within our circles and then within the community, if we stop blaming them to be witches and whatever, and we welcome them, then you shouldn't be afraid and scared.
Then I think these are the perceptions we need to let go, because we know that our mothers, like at the age of 22, at the age of 21, 23, they were getting married and giving birth. But with our age, we want to get to a certain place. We want to do certain things before we would want to settle. So
that's why the men also run away. Because when they come and you are a PhD holder and you are at that level, who am I to go there? So you won't get Amankwa coming. You won't get all of them coming, isn't it? Yes. But then we get the right person. They help us grow. We grow together. They support our dreams. Yes. And so alongside. And that is when, for me, I always see that men are very important in the fight of breast cancer. Because for them, they are brothers, they are husbands, they are boyfriends, they are fiancés, and whatever. They could actually be an advocate and reminders for us. I mean, if it's your wife, you know your wife's breast. I get it. So when there are changes of caring in, you will have to encourage the wife to seek help. In the past, some of our patients, is their husbands that saw the lump in their breast. And so the young people now who are going out with partners, how are you supporting your woman? Because you don't have to leave them to the disease. Isn't it? So men are very important in every aspect of our life, including the detection of the lumps and the changes that occurs in our breast.
And they're even more excited when it comes to the... So definitely they will
so please, it's not somebody will ask you. Sometimes when I go out for education, somebody will ask you, my husband or my partner bit my breast and I saw changes, please. It's not them, the touching of the boobs and whatever that causes breast cancer. Their teeth is not cancer agents.
Emphasis on that.
Yes.
Amankwa is nodding his head.
And their tongues are not cancer agents. Actually, they are really helping us to see any changes in the texture, in the feel of the breast. And then if you, the man, is a breast you use every day, so if you could see that there is a change in the texture or the feel of the breast, you should be able to ask that, hey, what is happening? I'm seeing this. Can we go to the clinic together? Can I support you do this? Don't run away from us when you see such changes.
But that doesn't mean that you should go on biting women's breasts
or
go on biting your wife's breast. Okay, doc, let's talk about the treatment of cancer. What are some of the treatment when someone gets breast cancer? The treatment that the person has to go through.
So commonly, I would say that for now, we have really advanced as a country. Ghana is within the lower and middle income countries category. And we are kind of faced with limited infrastructure and then healthcare facilities. But for Ghana now, we'll say that commonly now we have 2 big centers in the country. These centers are well resourced in the provision of care for breast cancer and other cancers. So Komfa-Anokye Teaching Hospital and then Kolebu Teaching Hospital, they do have the Center for Radio and Nuclear Medicine for the treatment of cancers. Yes, and then medical oncology. That is when we treat cancers with medicine. And all these facilities also do have machines. And so one of the machines that we use to treat is the radiotherapy. So it's kind of just like a radiation, kind of when you're taking an X-ray, you know. So these radiations, they put the breast or the site, the area where the disease is, and then it shrinks or it destroys the cancer cells. So one of the therapy is called radiotherapy or radiation therapy. That is using radiations to treat it. Then there are also surgeries. And that is when most of our women will want to frown on it and run away. Immediately they hear cancer or breast cancer, they are afraid to come to the clinic because they perceive that when I go to the clinic, my breast will be taken away. All right, so let me explain this. So cancer, look at cancer, it's like a tree, you know, and we know trees do have roots. So if and the roots, some trees' roots, you know, they can go deep down into the soil, and you see them getting into other areas. That is exactly how what happens with cancer, and of that matter, breast cancer. And so commonly when you cut the tree, and you don't uproot the roots, and you cut it, once you get water on it and it get the sun to start to manufacture its own food, it will regrow again. And so the treatment of cancer takes that analogy. So it's like we go in, we see how far had the disease gone. So once you come with a change and say, I have noticed this change, we won't automatically say it is breast cancer. All evaluations will be done. Like I initially said, the attending clinician will first have to examine the breast to confirm that I also see that change. And then they will request that you do mammography. When you do the mammogram, they will put the breast in a machine to take a picture of it. And it comes and it tells them, this is the change, or this is where I see the lump. Just an image in telling us there is a lump. And I've already said that when you take 10 lumps from 10 women, it's only one of them that will be cancerous. So we also need to do further tests to know if that lump is actually cancerous or not. And so we would take a bit of that lump inside the breast. So there's a small needle nowadays we use. We call it core needle or core biopsy needle. We won't take you to theater to do that. It's a small incision. Then they take a small piece of that tissue, the lump within, and they will take it to a special lab. That lab, we call it histopathology lab. They will study the cells. Are you getting it? And then when they study it, the report will come and perhaps confirm or not a cancer. So if it comes and it's a cancer, then your physicians will first also have to, or the surgeon will first have to do another test to see how far has this cancer gone. Because the cancer, like I said, is like a root. It can travel. So it can also travel beyond the breast to other organs. So we want to find out, has it gone to any other organs, such as maybe the lungs, the liver, the bones? So we do all these tests to confirm that it is just confined to the breast. If it's confined to the breast and the size, then we'll say that this is an early cancer. So in that case, they can go and remove the lump, or they can go and take part of the breast, that side which has the cancerous. So that is one of the treatment is surgery. We call it mastectomy. Are you getting it? So once we are done with the surgery, we cannot be assured that every small cell, every root of the cancer had been removed.
Okay.
You can't do that. So we have to push in medications or drugs, which it can be taken by mouth, or we give it through injections or through your veins. That treatment, we call it chemotherapy.
Oh, okay. We are familiar with that
with the chemotherapy. Yeah. So we are discussing the treatment options. So there could be chemotherapy, there could be surgery, and after everything, we need to take that area and the area of the breast where the cancer was, and put it under the radiation machine. The hope is that we are destroying every residue, every small thing that may have been left in, so that we prevent the future reoccurrence of the disease.
So that doesn't mean that cancer can be treated and we can say you had cancer but now you are cancer free.
Oh yes, so I'll put them into inverted commas. So I will say that we say breast cancer can be cured. Are you getting it?
Yes.
So we can treat you and say now you are cancer free. But we use the term you are in remission.
Okay.
Because all the agents that we expose you to as treatment can also be a risk factor for you getting cancer again. So after treatment, what we do is that you come periodically for us to check where the cancer was, to make sure that there is nothing starting again. Wow. And there are some medications we can put you on to actually stop the reoccurrence of it. So at that time, we call you that you are a survivor. You are a remission.
Okay.
Yeah.
Wow. So, do you have a personal story where you had a patient, the journey the person went through, and it's very inspiring and you would love to share with our audience?
Oh, yes. We do have all the mixed stories. So we have patients who had come with an early disease, stage 1, stage 2, and then they went through all the treatment. There is one whose breast was even removed, and she was a very young woman. And it's been 15 years down here. She's still living after going through all the treatment, free of disease, now married and giving birth. And she's been able to breastfeed with the other remaining breast.
Wow.
And there are women survivors who we even work with as advocates. Some had lived with the disease 15 years, 20 years. They are there. And they are championing these awareness campaigns to kind of engage women and empower them to take action and control of their breast. And there are also the sad stories where women actually come early. But when we propose a treatment plan, they go back. And then they are afraid to lose their breast, especially the young ones. When I lose a breast, who will marry me? So men, please, let's explore other means of breastfeeding, rather than only focusing on the breast. And then we empower them. Because of that, they refuse the surgeries and the other treatment. And it's like fire. When you refuse it and you come back in 1 or 2 months, a stage 1 disease or an early disease may have turned to a late stage disease, meaning that it has now spread to other organs. Once it is spread, there is nothing we can do. Although we can treat you and hopefully make you survive for some time, but we cannot take the disease away. Are you getting it? And that kind of give a very negative outcome. That is what leads to the death and that, and people associate death to the disease. It depends on the time you come. Early detection saves lives. Once you come in early, you are safe.
Definitely. So early detection saves life. Doc has said a lot, and I'm actually enlightened. I've actually learned a lot, and every month I'll make sure that I check my breast to examine my breast. But Doc, before we end, there is an award here. 2022 Beginning Investigator Grant for Catalytic Research. So tell us how you got this one. And if there is any project you are doing on breast cancer, you can also tell us.
So like I said, I do research in breast cancer. So for this award was a grant, or I received on a proposal forwarded to the American Association of Cancer Research and a foundation in the US that fund research for cancers. It's a global association. And so I put in a proposal, and based on my previous researches, which had really documented pathways of women cancer detection to treatment. It has shown that most of our women come late because most of them don't know about the disease and they don't know where to go. There are a lot of factors that leads to the late presentation. And the primary factor was lack of knowledge and then not practicing the self-breast examination. So I proposed to be able to develop an app, a mobile phone app, which Abena wants me to talk about. I proposed to develop an app which will be used to educate women about the disease and also prompt them to do their self-breast examination monthly. And so when I put in that proposal, it was actually a competitive proposal, a global thing. And then by grace, I was successful.
Wow.
So I was awarded that funding in December 2022, which I started the work in 2023 to develop that. So currently, our project is ending in November 30th, 2024. And I have to say that we have developed the app.
So the app is out. We can check it out.
It's not yet. It's a research process. So now we've developed the app. We are doing what we call usability testing. We want few women to test how the app will be. And if necessary, if there are revisions, we do them. And then we will seek for further funding to see how we will take the app into the communities and get women to download and use the app.
Can you share the name of the app, or is still?
We are tentatively calling it Breast Check.
Breast Check.
Yes. So it's going to be on Play Store when it is ready. So what it will do is that it's in a bi-language, like it's in English and it's in Twi. And so depending on your level, what you want to choose what you want to use, either English and Twi. And then there are components of the app. There is a awareness or education component that educates women everything about breast cancer we have talked about here. It also talks to women about clinical breast examination, what you need to do and where to seek for. Then there is also the screening or the examination part where women are walked through step by step with an audio visual videos.
Wow, that's impressive.
Yes, so every month you walk through it. It takes you through how to inspect your breast for these cardinal signs and then how to actually use your hand to examine your breast yourself. Then it gives you questions to answer based on the examination. You want to know what you are seeing. So there's a decision support tool part where at the end of the day, it will let you know that maybe you saw an abnormality, therefore seek help. And it sent you prompt to ask if you have actually gone to seek for help. And then after that month, you'll be allowed to set a date for your next month.
Wow,
And when it is approaching, it will send you 2 prompts for you to know that your time is approaching, and on the day of the examination, it will send you a prompt, and you'll still go through that to do the examination.
We'll definitely be anticipating the app. Breast Check, don't forget. Breast app.
Breast Check,
Breast Check. So don't forget the app.
Is a mobile health. So kind of the M represent mobile health, and Breast Check is do your examination.
So don't forget about Breast Check. Definitely we'll be waiting and anticipating for the app. It was so insightful to have you, Doc. We are so grateful that you came. Thank you so much.
Welcome, Abina, and thank you for your team for the opportunity.
So this is where we end today's insightful conversation. One thing that has stuck with me is every woman is prone to breast cancer, and it's good to marry early so that you wouldn't be more prone to breast cancer.
Give birth early,
yes, but you have to get married before you give birth.
That's
so
a
definitely So yes, don't forget to check your breast. Don't forget to go to the hospital to check your breast. It's the Breast Cancer Month awareness. and it's a disease that's affecting a lot of women, so there's the need to create that awareness. So thank you so much for watching, and don't forget to subscribe. Follow us on all our social media platforms at takeamso_pod, and thank you for watching. So this is where we end the conversation. So on 3 we'll say Takeamso. 1, 2, 3.
Takeamso.
Thank you.